Bona is a Cambodian boy, among many others, whose education has been significantly impacted by HIV. On a normal school day, Bona would wake up, eat his porridge, and go to school. However, his life hasn't been this way ever since he had contracted HIV by participating in homosexual activity. HIV is also higher among male-to-male sexual contact. Bona is now dealing with long and painful headaches, fevers, rashes, and many more. The pain he suffers from impairs and inhibits his rights to education. Many more are suffering like Bona, and the suffering can be attributed to the spread of HIV.
Since the early 1990s, HIV, or human immunodeficiency virus, has reached Cambodia and has killed roughly 94,000 people and brought detrimental harm to the country. Even though HIV rates have been steadily declining because of the support from the government, NGOs, and foreigners, there is still a high prevalence observed in key populations, which inhibits education quality for affected individuals. Therefore, there is still an urgent need to alleviate this problem by enforcing program actions and creating awareness. HIV, or human immunodeficiency virus, is a virus that attacks the immune system and makes the infected person more vulnerable to illness. HIV is transmitted through sexual contact with infected people, involving the exchange of fluids or by sharing needle syringes or injective devices with others that have HIV. HIV can also spread from a mother to her baby during pregnancy, birth, or breastfeeding. Leaving HIV untreated may lead to AIDS, the abbreviation for Acquired Immunodeficiency Syndrome, which leads to further weakening of the immune system. The first known HIV case in the world dated back to 1959, where a man died from HIV in Kinshasa, the capital of the Democratic Republic of the Congo. However, the first case of HIV in Cambodia was detected in 1991, and the rates for HIV have been steadily increasing until 2001. In 1998, the HIV cases were so serious that a total of 65.4 workers got infected with HIV. To be precise, 42.6% of them are sex workers, while 19.2% of them are indirect sex workers.
This is a quote from Quinn. Fortunately, in 2005, AHF, American Health Foundation, Cambodia, introduced its first program. We were able to conduct an interview with the program manager of AHF.
In AHF, we are working with the partnership with the government, like national program, to have, like we have the activities such as the HIV testing through community testing, through health facilities testing, and also our what we call mobile van testing. This is also community testing. And another one, we have care and treatment, provide support to the ART clinic, some part that is joint venture with the government, with the national program. And another thing related advocacy and the marketing as well. So for the testing, at the community testing, also at the health facility testing, whenever we found, a new case of the HIV positive, we try to link those people to have a treatment and care, to get ARV drug.
ART, or antiretroviral therapy, refers to medication that is used to treat HIV. It cannot cure HIV, however, it can ease the lives of people with HIV by allowing them to live longer, healthier lives. AHF is providing support to more than 46,000 individuals. Since 2011, AHF has created free HIV testing campaigns at hotspots, entertainment venues, parks, and the public gathering of events. As we see here, programs and organizations have already done a lot to improve the HIV rates in Cambodia.
Despite this, rates are still affecting people of all ages in Cambodia. In this graph from the United Nations Development Program, we can see that HIV truly impacts education in Cambodia. This graph focuses on males receiving education, but we can see that the males without HIV have a higher attendance rate in school than males with HIV. This correlational relationship shows a negative correlation between HIV and school attendance rates in Cambodian teen males. For the females, it is the same. There hasn't been a point in the graph where the females without HIV have a lower attendance level than the females with HIV. This just goes to show the impacts of HIV on education. Another graph shows the correlation between children with HIV and the frequency they have had to repeat a grade level. We can see that the kids with HIV have always had to repeat a grade level more than the ones without HIV, with the exception of ages 15 to 18. Education is important as it promotes critical thinking and innovation. Without education, our modern world wouldn't be where it is today, and having children infected with HIV is not going to further develop education in Cambodia. Those infected with HIV have a lower attendance rate and a higher chance of repeating grade levels. This is evidence of a lowered quality of education, as the children will not gain as much information from attending fewer classes. Therefore, a feasible and attainable solution is needed to eradicate HIV as much as possible.
Something we propose is to conduct meetings for the purpose of collaboration. As of now, Cambodia attends meetings with the UN to discuss issues about HIV/AIDS. The most recent meeting was last year, which was held on Zoom due to COVID-19 restrictions. In the meeting, leaders will talk about progress of commitments and recommendations for improvement. In addition, leaders also address how HIV impacts the 17 Sustainable Development Goals, including the fourth goal about ensuring quality education. We think that this meeting is extremely beneficial, but another way to improve is to hold meetings between the HIV organizations inside Cambodia, such as AHF and CHEC, to share pertinent information that has been passed on during the UN meeting. We believe that sharing information, such as strategies to help the people with HIV, will be beneficial for all the organizations to hear. This solution is feasible and doable. It can be achieved by setting up a time and place to gather up. The suggested place is the Ministry of Health in Phnom Penh because the location is convenient, and for time, once every 2 months is a good balance for the organizations because figureheads may be occupied with the work of their own. When organizations, foundations, and NGOs receive information, they can implement the strategies to their own work and see if it will be beneficial. Improving the ways to treat HIV and the spread of it will not only improve the HIV rates overall, but it will also improve the treatment for children who attend schools too. Letting students get treated with HIV can help them reduce symptoms and allow their health to be good enough for them to attend schools and better their education.
To summarize, Cambodia has experienced many hardships due to HIV. The rates of HIV have been increasing up until 2001, and if it weren't for the hard work of the diligent and active organizations, such as CANA and AHF, then Cambodia wouldn't be where they are today. Still, populations with HIV in Cambodia still suffered a lot. The education quality is lowered for the ones infected with HIV, which is truly inconvenient. Evidence has shown the negative correlation between the individuals affected with HIV and education, which is why an action plan to resolve HIV is still necessary. The action plan is to, hopefully, conduct meetings to discuss improvements needed to lower the rates of HIV in Cambodia. As students, we also have a way to take part in this issue. This is an interview with our school nurse that informs us about what we can do.
The most important thing is that practicing safety behaviors, protecting yourself is very, very important. I think it's very important for students, everybody, to learn more about sexually transmitted infections, not just HIV alone, but there are many STIs in the world, and they transmitted, how they transmitted, and their prognosis and prevention is very important, just to learn more about STIs.